we're celebrating the one-year anniversary of the Affordable Care Act. The majority here is celebrating its 3-month anniversary of ignoring the jobs problem in this country. And I think one of the ways we've got to think about this bill and this law is how it affects jobs. And you've given us some really good evidence here today. Dr. Flinner, one of the things that's in the health care bill they want to repeal is funding, as you said, for, as Mr. Clyburn made sure it was there, for capital construction of community health care centers. How many of those construction workers would have a job if they succeed in repealing that construction money that you got?
Well, we will put the equivalent, as I said, of 45 full-time workers at work this year, which translates into hundreds of individuals because they come in waves of the steel workers and the concrete pourers and the electricians. None of those people would have a job. And I said to Sal Monarca, the fellow I told you about who owns the Mason Company, what happened to those 60 people that you laid off? He said they collect and they cry.
Exactly, and we want to get them working again. And
exactly.
Mr. Toomey, another thing Mr. Clyburn led the way on was $9.5 billion for operating expenses for community health centers. I see you have about 270 employees. If you receive some of that money, would you add people and add services?
Yeah, correct. So we're ready to do just that. We're set to add actually 2 new sites and probably about 60 new jobs in the next 3 years.
They want to repeal that too. Now, Dr. Cole, you should run for Congress, first of all, unless you live in Mr. Boren's district. You should run for Congress. And I just thought your presentation was terrific, and I love the story about your UPS driver who, you know, he could track a package anywhere in the world, but they couldn't find his lab report. Is he a more productive worker if they can find his lab report faster and make sure he's okay and ready to go back to work? What does it do to the quality of the workforce to know people's medical records?
Absolutely. You know, one of the big issues that we fight in a small town in particular, if you have a single mother who has a sick kid, she's off work for 3 days. She's going to be out of school getting the kid there, getting the care, getting to a pharmacy the next day. You know, you put that into a chronic care model where somebody has to have lab work and then we have to chase the papers for days. That's
not very productive, is it? And you know, in the American Recovery Act, there's significant money to expand medical records. They want to repeal that too. Ms. Harris, I was very impressed by your story. I've been to Lancaster, California. I have. My daughter has recorded some music there, so I've actually been there. And I was impressed about your story. One of the things in the Republican budget before us is to cut 200,000 job training slots in our country, and to cut maximum Pell Grant scholarships by $845 a year. What would that do to your students, and what would that happen at how would that affect your school?
Well, the Pell Grant cuts would make it so the students could not participate in the school or enroll in the school if they didn't have a financial backing. We do get funds outside of the Pell or other funds that we can make.
And what would that do to the employers who employ your students?
We would have to lay off. We would have to lay off our staff. And
what about the people who hire your graduates, though? What would it do to them?
The people that hire graduates, well, it would make that there would be no graduates for them to hire, is what it would.
Which make them less successful as businesses. I yield back, bounce, but I think this panel has given us, you know, exhibits A, B, C, and D of what's wrong with the majority's approach and what ought to be done differently. I yield back.
Ms. Castor?
Well, thank you very much. I really enjoyed the witnesses today, and I'm grateful to all of you for your expertise and your advice and insight. I'm also very grateful to my colleagues, Rosa DeLauro and George Miller and Karen Bass and Mr. Clyburn and all of my colleagues, because of what they did first in the Recovery Act in creating jobs in community health centers all across the area I have the privilege of representing in Florida and the Tampa Bay area, and then for the Affordable Care Act. But first on community health centers in the neighborhoods I represent, I saw in a working class neighborhood, a very proud neighborhood, they had for many years held a large lot and property that they knew it was a perfect location for their new community health center. This is in East Tampa, across from a large urban high school. And just perfect. And the Recovery Act brought the funds home to allow them to construct it, and it went up quickly. We broke ground, and then we were at the ribbon cutting before you knew it. And what's great is you have all the construction workers there with the architect, and then all of the new healthcare staffers and the doctors and nurses and everyone from the neighborhood. So this has been such a godsend in the middle of the recession. We also had another one across town in an area that has not gotten a lot of attention because we have a lot of immigrant families there. It's a large Hispanic neighborhood. And what we were able to do is take an abandoned Saturn car dealership. It was just sitting vacant for many years, and the community health center was able to go in, rehab the whole property. You know what it's like to take a vacant, empty commercial property on the main drag and fill it with a bustling community health center. And I love going in there to see all the dental chairs for kids, because there's really nowhere else to go for children for dental care in Florida. They don't provide it under Medicaid. Right. So I'm so grateful to all of you and to my colleagues for that. And then to follow on with the Affordable Care Act. I do not think that the health care reform and the Affordable Care Act has gotten enough credit for job creation. And yes, it's community health centers, but there's also a piece that we worked very hard on that we should spend a lot more time talking about. And that is all of the new scholarships and loan repayment initiatives for young people or anyone who wants to enter into the healthcare workforce. We are going to create the modern healthcare workforce in America through the Affordable Care Act. And we're talking the pediatricians and doctors, but also very robust investments in nurses, physician assistants. If you are interested in public health in America now, boy, there are great opportunities for you to attend school and colleges of public health and then enter that field. Also in mental and behavioral health, and a huge investment in the National Health Service Corps. Now, it's exciting for my community because we have a large university that has a College of Medicine, a College of Nursing, a College of Public Health, and physical therapy, and everyone is just thrilled because we're going to be able to have all of those great professionals in the community health centers. But I want to hear from you all. Do you think people are aware of this? Are you all aware of it? And what can we do to kind of raise the level of discussion about the jobs that will be available and the training opportunities under the Affordable Care Act under these new scholarship and loan repayment plans? Ms. Harris?
I am personally aware of it, but I don't think the community at large is aware of it. And I think that maybe having community meetings with representatives coming to their respective communities and talking about the jobs that will be made available and the grants and scholarships that would be available to students to encourage people of all ages, of all interests, to seek further education and to be able to then go back and help their communities with a healthcare career that would be more than welcome in their communities.
Right.
I would just add, I think that what's underappreciated, and I try and talk about all the time, is the great democratization of the higher education and the health professions that the Affordable Care Act brings. That we can say today that your sons and daughters, your brothers and sisters, no matter how meager the economic circumstances of their family, can go to medical school, nursing school, dental school, public health school with a vision for how those tuitions and the loans can be repaid on the other side of it. And I think when we go back to health disparities, there's a link there as well. We have got to do a better job about recruiting and engaging minority persons in the health professions. That's a big focus of ours, and I think the Affordable Care Act, through both the scholarships and the traineeships, but also through the National Health Service Corps expansion, really gets at that in a very profound and important way. So thank you for that.
Thank you, Rick.
One thing I would say, it's something that Oklahoma is a very interesting place politically, but that's one of the things that we know about and we're ecstatic about. I can tell you, I left Oklahoma this morning at 4 a.m. and I will be back by 11 p.m. because I'm the only doctor in 60 miles that delivers babies.
Got them on hold?
Yes. There is one girl who was given explicit directions last night not to have a baby today. We've been trying. We try every
Get
day
to the
to recruit
airport.
doctors into rural areas, and this helps.
Thank you.
Thank you.
Thank you. Jan.
Oh.
Councilman Schakowsky. Jan.
Let's see, is that a no?
No.
It doesn't light up.
It doesn't light up, so just touch it and try.
Let me try this other one.
It's on.
There we go. And we got it. Welcome so much. What a wonderful panel you have been. I appreciate it. I'm sorry that Congressman Clyburn left because he really has been the champion of community health centers, and I wanted to thank him publicly for that. A couple questions. I think it was you, Mr. Toomey, that mentioned referred to middle-class people coming in now, and I'm wondering if we're seeing now, because of the increase in people who are unemployed, if you're seeing a different kind of clientele than you may have had before, increased number of people that are seeking out help from the community health centers, and what's that doing to the stress on the resources that you have right now?
So yes, that's exactly what's happening. So our number of uninsured continue to go up. The old line from Ed was orange juice isn't just for breakfast anymore. So health centers are not just for poor people anymore, and it's really for people who can't get access to care, not because they're poor, but because they can't afford health insurance. And that's what we're really seeing over and over again in our facilities. And then even if they can afford the visit, they can't afford the cost of the medications. So we've had multiple people from our small business program come to us who knew they were sick, knew they could see the doctor, but knew they couldn't afford the annual costs of the medications. And when they came to us, they could. People often...
Are you referring now to the relationship that you said you have with the Chamber of Commerce?
Yes. So, people oftentimes go to a healthcare provider and leave crying because they heard bad news. For us, people leave crying because they're so grateful that they can finally see someone get their medications.
Yeah. Dr. Cole and Dr. Flinter, are you seeing an increase in people who have recently lost their jobs, or not so recently, actually?
Last year, we had 12,000 new patients at the Community Health Center in Connecticut, the richest state in the country, as people often remind us. So many people were already forced down towards the margins of the middle class. The recession was really the kick that pushed them over. And the spiral that we see is so rapid, from loss of job to loss of insurance to loss of home to homeless. And that's a picture that we see over and over again in our communities.
Not so much in my case, but it's because of the uniqueness of where I live. I live in an agricultural area. Our two main employers are the hospital and the school system, and then cattle ranches. So long as people buy beef, we continue to have jobs. So that's where we're at right now.
I wanted to ask a question. One of the things that the Affordable Care Act does is make sure that everyone has access to health coverage of some sort. In that picture, does the role of the community health center change at all? Why is it important for us to continue to support community health centers in an environment where everyone is going to have access to health insurance?
Sure. I think we'd all probably answer with the same question, access to what? And we've seen this over the years sometimes with Medicaid when there weren't Medicaid providers. Great, you have an insurance card, but you don't have access. We have a near and long-term shortage of primary care providers in this country, as well as other kinds of healthcare providers. We all need to be rowing in the same direction about creating access. And I think Representative Clyburn said it well. People want to go for care near where they live and work. That's where the most effective preventive care and primary care can take place. So I think health centers are even more needed going forward. And one thing that none of us really talked much about is the essential role of community health centers in training the next generation of primary care providers. It's not just about the employees of today, but it's the people we're training for the future. In Connecticut, every year we have over 100 students of the health professions, all the health professions, from colleges and universities who come to us for a portion of their training to be trained to a model of care that we all, I think, in this room believe in. It's why we created the residency program for the nurse practitioners. We are making a contribution to making sure that it's not a question of access to what, but it's really access to that kind of primary care.
Thank you.
Ms. Sheila Jackson-Lee.
Let me try to talk loudly. Let me thank.
It's on.
Don't touch it.
You're
No,
on.
Let me thank.
touch it one more time. Now,
right.
it doesn't go on.
Let me thank everyone, including our co-chairs of the Democratic Policy and Steering Committee, Mr. Miller and Ms. DeLauro, and my colleague, Congresswoman Bass, and my entire Democratic caucus, who unselfishly said this was so important. We worked hard to secure bipartisan support. We engaged, we held hearings, but this was so important that individuals did not consider personal standing, but realized that this was a historic opportunity to change the lives of Americans.
Mm-hmm.
And I am grateful to all of you for putting a face on what we thought was right. It's important to have people come and tell us it is.
Mm-hmm.
And as we begin to look at the effort to repeal, and I saw a late night television ad that keeps repeating on the cable stations about you still have an opportunity to repeal, sign this petition, because obviously they are talking about the Senate that has not moved on this at all. I think they get it. I think they understand what you're saying to us. And I just want to put on the record about the economic impact, and I want to ask all of you a question just going down the row. If you put in a $2.2 billion worth of federal investment, you will generate $20 billion in total economic benefits to resource poor, rural, and urban communities. That is with respect to community health clinics, 189,000 jobs, and overall up to 2015, you'll be looking at $53.9 billion in economic activity. And I think you all have documented the record either by individuals doing their internship, training, health professionals, which I think is so important. And then, of course, $284,000 in jobs. So I want to ask the question as to how devastating would it be to close the doors of a community health system, federally qualified health centers, which have many of them mental health services, dental services, of course, pediatric, geriatric, prenatal, for people who have not had access. I understand you've just put on the record increasing number of middle class, but we know that low-income populations, and then, of course, the strident and difficult job of creating access for minority populations, Native Americans that may be in Oklahoma. So give me your most devastating result if we were to repeal this and lose electronic records, or lose the $45,000 that we give to doctors to be able to continue to do electronic records, and then close the doors further for these centers to be open across America. Dr. Whelan?
What you're talking about is just inconceivable, especially given this 45-year history of what these have done to communities. So not only will you see patients not having access, you'll see decays, cavities in the middle of cities where the economic development is disappearing. We also know over the next 10 years, the Department of Labor estimates that 6 or 7 of the top 10 fastest growing jobs are in healthcare. And if we don't have opportunities to train them, we don't have opportunities, this is not going to just stay in those communities. It's going to be people flooding to emergency rooms where there is no better source of care. They're not going to get follow-up care. It's going to be more expensive for everyone, and we're also going to have this paucity of brand new providers who need to be going elsewhere for to take care of all of us as we're aging.
Ms. Flinter?
When Congresswoman DeLauro visited with us last Friday, we had the opportunity to speak with Florentina, a patient of the Community Health Center. And I think she's a great example of the fact that people, I think there's an assumption sometimes if you close the health centers, well, you can always go to the emergency room. Well, you can't. And even if you go, you can't get what you need. And Florentina told us about losing her job, losing her insurance, losing her home, and being so sick with this headache and neck pain and chest palpitations and no insurance, couldn't go for care. And, she took the only action she could. She went and filled out a living will. She thought that was probably the next best thing to do. And she called it the silent euthanasia. And I think that's what we will see, the silent euthanasia from people not having access to care. And what a joy it was really to see her. She had come, established a relationship with one of our nurse practitioners. It was her dental abscess that was causing all the problem. And I think we would agree she was radiantly, passionately, vitally healthy when we saw her. But that really stuck with me, the thought of a silent euthanasia from people not being able to get what they need.
That was powerful.
So right now, 309 million people in the country. We saw 20 million of them last year in a health center. That's 1 out of every 15 people in this country got their care at a community health center. If we could continue with the Affordable Care Act, and that's 40 million people, that means 1 out of every 8 people get their care at a community health center. If it's not here, it's devastation, and we're a third world. The fact is, we can do these things for people if we could just focus on it. 2 other things. One is nobody in this country doubts that we don't have great care. They doubt 2 things. One is whether they can get access to it, and then secondly, if they do, whether they have to go into bankruptcy when they get it.
Dr. Cole?
Will Rogers said, all I know is what I read in the papers and see around me. And I can tell you what I see around me is that if the CHCs are boarded up, I become not only the only doctor who's delivering babies, I become the only doctor who's seeing anybody.
Wow. Ms. Harris?
The closure of community care hospitals or community care clinics would be, without question, devastating. The care that people get nowadays who don't have health insurance is in the emergency department. But we see across the country, and definitely in California, that emergency departments are closing down or hospitals are being built without emergency departments just because the cost of emergency care is so expensive. So we close down the community care health centers, we close down the emergency departments, people have no health care at all. And so people will die in the streets is what I see happening. People now are hesitant getting health care because they know they won't receive any or they can't afford to receive any. If they do try to get health care, what happens to them when they have to pay the bill is they might end up becoming bankrupt, which bankruptcy or health care costs is the leading cause or one of the leading causes of bankruptcy in our country. America is about providing opportunities and benefits for people, and health care is an opportunity and a benefit that should be available to people and not closed down. We can make it affordable, and we should be making it affordable.
Thank you all very much. We have our marching orders. Thank you.
Ms. Capter. Thank you very much, Congressman DeLauro and Congressman Miller and Congresswoman Bass, for bringing us all together today in this outstanding group of Americans. We're just so proud of you and the work you're doing in your respective states. I come from the upper Midwest in Ohio, right up against the Canadian border, and I can tell you that we view the work that you do and the individuals in our region who run the community health centers as just completely vital. They're part of the real glue that's holding our community together right now during extraordinarily difficult times. I was interested in the handout on America's health centers because it indicates that nationally your health centers see on the average 38% or so of people who have no insurance. I can tell you in my district, I was just told by the director of our community health centers over the weekend, it's 79% have no insurance. It is extraordinary. And part of the, we know that in the health bill that was passed, and in about the last year and a half since President Obama has been president, we've created about 1.4 million jobs in the country. About 233,000 of those have been in the health sector. So we are trying to grow jobs in this sector, and we need your voices very much, and thus we're appreciative of your being here today. I'm a little surprised at some of the statistics we were given because I find them hard to believe for my own state of Ohio. We've got this one chart in the handout that says that what percent of the population below poverty is served by the health centers in Ohio, and the answer is 8%. 8%. Yet we have cities like Cleveland, Youngstown, Steubenville, Dayton that are just, Toledo that I represent, devastated. I can't believe the number. Either we don't have enough health centers, or they're in the wrong places, because when I look at next door Indiana, they have 8% of their people being served. Indiana's a very different place than Ohio. Iowa has 18% of the people being served below poverty. So I really don't understand what these numbers mean for Ohio, and maybe I'm reading it to say that Ohio isn't really measuring up to the level that it should, though I know my area is trying very hard. So I just wanted to mention that in terms of the handouts. I'm going to ask you a rather curious question. To your knowledge, do any of your centers, or have you ever dealt with a product called heparin and the price of heparin as a one of the medical products that you are familiar with in your region? Anybody ever used that or seen that used as a blood thinner?
Sure.
Do you happen to know what you pay per bag?
Well, they probably don't have these, right?
I don't know offhand, but I can find out soon and send that to you. Again, because we have 340B drug pricing, health centers are qualified to get 340B drug pricing, the same cost as like the VA gets. That's 55% of the average wholesale price. That's what you would get in health centers, is whatever that pricing would be. I just don't know what that is offhand.
Right. I would be very interested, Mr. Toomey, if you could.
I will send that to you.
I'm looking for some of these. I think one of the weaknesses of the health bill, in my opinion, was that we were not able to get negotiated pricing, as we have with the VA, for all pharmaceuticals in this country. And this particular product is costing us an arm and a leg in Medicare. So I'm interested in what you are, perhaps through your centers, paying.
So just, again, the advantage of a health center that you all have helped us with is that we do have that group purchasing program in health centers built in, because we're eligible for 340B drug pricing. And that's built in when a patient becomes into a health center, we can provide them those drugs at that cost.
I thank you for that clarification, and just will end with the wonderful chart on page 3 that shows the average cost per patient that you care for per day is $1.67 versus a hospital inpatient visit at $41.36, or a hospital outpatient visit at $7.59. You are America's best price and best quality for health care, and we just thank you for what you're doing.
Thank you.
Yes, doctor.
I'd have the price for heparin for you.
Thank you.
1,000 units per mil, a 10 mil vial, we pay $189 for.
$189. Unbelievable.
For 10
And I'll just say this, and I'm picking on them because imported heparin ingredients cause deaths in this country, and I'm very angry with the companies that have done this. And I'm not done with them yet. And but for an off-patent product to cost that much with almost no competition in this marketplace is outlandish. And it's costing the American people billions of dollars. And we need to pay attention to what is happening with the cost of some of these pharmaceuticals and medical devices, and particularly medicines, when they're off patent, not to have competition at a keen level and be importing so much from abroad in the way of ingredients is an underbelly of medicine that we don't have time to go into this afternoon, but it is costing the American people dearly. We could be putting that money into patient care and into residencies and to additional personnel to help you serve the people who are ill in this country. Thank you so very much for being here.
Thank you. Ms. Bass?
Yes, I want to once again thank the panel. I think the panel has just been absolutely excellent in every area that you testified. Really appreciate you taking the time out, and we got to get you some help, Dr. Cole. You need to have a PA.
Send on my way. I'm actually a preceptor site for nurse practitioners, so I have
you
a
are?
nurse practitioner student that works with me pretty much continuously. So.
Oh, excellent, excellent. That's great to hear. Well, I just have two quick questions, but I wanted to touch on for a quick second the emergency room issue that Ms. Harris raised. And I don't know if this is something that's just happening in the LA area or Southern California, but we really have had numerous closures of emergency rooms. And sometimes you don't want to document things. And I know one thing without question, that it has resulted in deaths. And one thing that I do want to look at is whether this is a national phenomenon. But a couple of quick questions. Ms. Harris, in your school, given the economic crisis and the rise in unemployment, have you had an increase in the number of students who have been laid off of other jobs and come looking to get a career in healthcare?
Yeah, absolutely. We have. The increase that we've seen has been because there are no jobs available or few jobs available, and so people come to school with an interest in trying to change their career or get a new career in order to go out and try again in maybe a different field and find a position.
Well, one thing I do hope that we do over time, and that's bring much more attention and publicity to the health careers and tie it to healthcare reform so people will know that will be the future. I wanted to ask a couple of the other practitioners, if you do utilize nurse practitioners